evening, YouTube fans.
Hey, how do we start on my channel?
I can start on your channel if I want to.
You have to welcome friends, subscribers, and internet
I
strangers.
know that.
Okay, go.
Welcome, friends, subscribers, internet strangers.
What's up? She wouldn't do that part.
That's true. It's Wednesday evening, October 31st. As many of you know, I have been diagnosed with triple negative breast cancer. And so what I had asked Scott to do was a weekly video kind of chronicling my journey with breast cancer, because there are so many that have gone before me and so many that will go after me. Unfortunately, my type of breast cancer only comprises 10 to 15% of all breast cancer cases. It is triple negative, which means that it does not respond to any kind of hormone receptors. It is HR negative, HER2 negative, which means that on the little Y of the breast cancer, there's usually little divots there that hormone receptors can attach to block that and to keep it from growing. Mine is an ugly beast that can only be eradicated through surgery and chemotherapy. And radiation.
The one thing, we have 3 dachshunds that will come and go. They are...
And this is my baby.
Phoenix is the lap dog. He has had 1 back surgery, so he'll probably lay here the whole time. But the other 2 will come in and out of the video because they are just...
The black one is Dixie Belle. She's my little girl. And the brown one is Scrappy, and he is Jacobs.
He's the terror.
He is a terror.
Okay, so we've covered... I made a list. We've covered what type of breast cancer you have. Alright, so how did you discover you have breast cancer?
I discovered I had breast cancer because I found a lump in my right breast that was painful, and it was getting a little naggy. I'd had fibrocystic changes when I was younger in my breasts, meaning they kind of feel lumpy, but they were always ruled out because it was always around that time of the month. And it was nothing really to worry about. Well, I'm postmenopausal at this point. I was thrown into surgical menopause when I had my ovaries removed in 2013 because of endometriosis. I was a little concerned about the lump in my breast, and then it just became painful. So I asked my doctor for a mammogram. My doctor sent the orders for a screening mammogram. The ladies at the breast care center came back and said, you know, you told us you have a lump in your breast. The orders are written wrong. This is just for a typical screening. We need to have the orders written for a diagnostic mammogram. The difference between a diagnostic mammogram and a screening mammogram is that with a diagnostic mammogram, the radiologist will be on site with you, so that when they do the images of your mammogram, the radiologist can immediately order an ultrasound and, if need be, order a biopsy and do the biopsy right there. We did that on National Mammogram Day. I had to fight for that. My doctor said, oh, it's not protocol for me to write a diagnostic mammogram without actually feeling the lump in your breast, even though I've been telling her that I had a lump in my breast. And she said, but I've written the orders anyway, and she was very snarky about it. Don't let your doctors run over you. They're the reason, you're the reason they have a job. So I told the lady at the breast care center that, and she said, don't worry about bringing us the orders, you just get in here. A weekend later, and my life was changed forever.
Okay, so do you have, let's talk about some risk factors for this type of breast cancer. Do you have a family history of breast cancer?
No, I have no familial history of any kind of cancer.
So that's what I just wanted to make that point. It doesn't matter if you don't have it or not, because for this type of breast cancer, the risk factors are, it's in younger people, which means it's most likely to occur between ages 40 and 50. And yes, even though we're 40 to 50s, you consider younger, considering, the average age of adults live, 75 or 76 in the U.S. This one affects African American and Hispanic women at a greater level than it does white women, and it also highly affects people with the BRCA1 mutation. And we did learn. So what the next one is, we're going to go over the steps we've taken so far, and one of the big things we've learned. If you want. We talked to a geneticist yesterday.
We talked to a geneticist,
and
my
explained
oncologist.
the difference. You don't get tested. I was wrong, and you were under the same impression. You don't get tested for the BRCA, the BRCA gene, because you have the BRCA gene. So tell them what the test means for that.
So everyone has a BRCA gene.
There's BRCA1 and 2.
There's BRCA1 and there's BRCA2, and they're looking for the specific gene mutation. So in my particular test, the geneticist, who was so super smart, and she kind of blew all of our minds. What she's looking for is, out of 26 alleles, she is looking for mutations on all of those genes, not specifically for breast cancer, but for any other kind of hidden gene mutation that could be out there, whether it's for colon cancer, for stomach cancer, for liver cancer, lung cancer, all of those.
Yeah, the one thing that struck me was she told us that, she won't be able to tell you why you got breast cancer or why, but she would be able to tell you based on your genetics, you are more predisposed to certain types based on all these different. And I was under the impression, if you got the BRCA gene, the BRCA gene, that's it. I mean, but it's the mutation in it, because those two genes actually are what tells your body to fight cancer. And so when there's a mutation, which means you want to be, sorry, the battery died.
Where were we?
So you want the genetics test, you want it to come back negative, which negative means it is
normal.
There is no negative, means no mutation. So she had blood drawn, and it's 10 to 14 business days, because of the doctor's insistence that we get moving quickly to get ahead of this. She said it would most likely be, she's going to insist that it be on the 10-day side instead of the. But that was, the genetics lady was very smart. She drew out the whole family history, and she, we went through each person. So just
super
very nice, extremely smart. And that's the one thing I want to tell you through this whole process. We have met some wonderful people. They are so caring and kind. So the first step was, she was yesterday. So last week, the first person you met with after
my diagnosis,
they sent you for the breast MRI.
Well, we met with the breast surgeon first.
Oh, that's right. He sent us there.
And he, wanted to know just some basic things. He told me he read my radiology report and explained that I do have triple negative breast cancer. He told me basically what my course of action would probably be under the care of Dr. Philip McGee at Clearview Cancer Institute, and he ordered a breast MRI.
He also explained to us that, which we didn't know, we didn't realize that breast cancer is a systemic cancer, which means you have a tumor, and the tumor not only is growing, but it's also pushing cells into your bloodstream. So it is spreading the cancer cells throughout your entire body. So the studies that he taught us about, he said there is no statistical difference between a massive surgery and if you can get away with just saving the breast and
doing a lumpectomy.
Because the chemotherapies will come behind it and treat the whole body.
Right.
And so he said that in the 60s, 50s, 60s, they used to think big surgeries, massive surgeries, cut everything off, but the success rate of living past 5 years was no different because you didn't treat the rest of the body. So
systemic control is those two words have been used a lot in the past week, and that just means that they want to treat the whole body versus just the breast. Went Friday evening for my breast MRI, and guys, I've had many MRIs in my day, CT scans, etc., because I do have degenerative disc disorder. So I've had some major back surgeries. A breast MRI is a little bit more like a torture device. Because you're kind of tilted at an angle, face down. They put you in the face part is kind of like a massage table. The rest of it is kind of tilted down. Your breasts are exposed in two holes. And just imagine laying tilted off of the edge of a table with your rib cage under your breast for 30 minutes.
With your hands above your head like Superman.
With your hands above your head like Superman. Not comfortable. So believe me, it was not comfortable. And we've all come to the realization that a man had to
to have designed that.
To have designed something like that. The good thing is, it's because you're head down, you don't realize how small of a hole that you're in.
The claustrophobia doesn't.
So, the claustrophobia isn't really there. Of course, I'm not really claustrophobic when it comes to MRIs anyway. Speaking of which, our next steps.
Yeah, the biopsy, she had a biopsy, I don't think we mentioned the biopsy. Once they did the mammogram, they determined there was a tumor, they biopsied the tumor there. That's the other different with the diagnostic mammogram, is because
I did that.
Oh, did you?
Yeah.
Well, it said that the tumor was 2 to 2.5 millimeters.
Centimeters.
That's millimeters.
Centimeters.
Well, however they're measuring it, the MRI came back as 5.
Right, but they don't know if it was because it was aggravated because of the biopsy, because I have a huge hematoma on my breast because of the biopsy, or they just didn't get a big enough cross section when they were doing the biopsy.
The oncologist will personally look at the MRI. He said that he would definitely make a decision of the size of it before we saw him again.
The cool thing about going to happen tomorrow that I won't be present for is that all oncologists and breast surgeons, radiologists in town.
But it's not all of them. It's all the ones that are on the cancer board.
All the ones that are on the cancer board get together at 6:30 in the morning, and they have a breast conference. So they will present my case along with every other woman's case who has been newly diagnosed with breast cancer.
Or if there's
if there's an ongoing case that needs to be.
That they need to make a decision and they want the group's consult on.
Right.
Right.
So it's like getting 20 different second opinions without having to pay for them.
And 3 or 4 of your doctors are going to be on this thing.
Right. And so I have a lot of doctors on this board, and they will collectively grade my cancer because of the differentiations between my biopsy measurements and my MRI measurements and my mammogram measurements of my tumor.
So the radiation guy was next yesterday.
The radiation doctor, who's Dr. Jim McCarty at Alliance Cancer Center, I feel like we kind of put the cart before the horse on that visit.
But he said he likes to meet everybody at the beginning, so he's not a stranger.
Right. He's super funny, super nice. He kind of gave me an overview of what to expect during radiation.
Why it was
necessary. How my skin would change during radiation.
It'd be like a sunburn.
And it would be like a sunburn.
And at the end, he said it would be like blisters, like the worst sunburn ever.
Right. And, well, you know, I'm not really one to sunburn, so I don't really know how that is. But, and hopefully I won't have to see him.
It depends on if it is a 2.5 whatever measurement tumor, it will not necessarily need radiation. But if it is the 5, anything over 2.5, they recommend
typically
radiation.
Does have radiation. We met with my oncologist next, Dr. Philip McGee at Clearview Cancer Institute, who is, again, super, super smart. Let's just put it this way. We got there at 1 o'clock. We didn't leave until 5. And that was with Dr. McCarty, the geneticist, and with Dr. McGee. Dr. McGee and his staff really threw a lot of information our way. He is so caring and basically said, look, I'm your everything doctor for the next foreseeable future.
4 to 6 months.
And he explained that he called his mentor and teacher at UAB yesterday and talked specifically about my case and one other patient's case, just to kind of get a feel for what she would do, and to see if he was on the right path.
And she confirmed everything.
And she confirmed everything that he was thinking.
So tell him why he's going to do chemo first. So tell him you had 2 choices. You can either do chemo and then surgery, or you can do surgery and then chemo. So tell him why he's doing the chemo first.
Well, he wants to make sure that it's going to shrink. And he said that, they will put in a portacath in my right under my left clavicle. They're not like they used to be. They are completely covered by skin, which is a good thing.
you'll just be able to feel it. He said
yeah,
like a little body. He said
it looks like a little bit of an alien popping out of the skin. You can look up portacath on Google and Google some images of that, and the way they actually snake a cath down your superior vena cava so that it truly is a direct line. What was the other reason he wanted to do chemo first?
Because he wanted to get systemic.
Systemic
he wanted to
control.
get that. He wanted to get the control of there. And if you do the lumpectomy first, and then he starts the chemo, he doesn't have a way to tell if the medicine is truly working, if the chemo is working. So with the lump still there, with the tumor still there, he can measure it, he can track it, he can understand the first two medicines, and they are.
The first two medicines that I will be having in my drug cocktail are Cytoxin
Good luck with that.
and Adriamycin.
Okay.
I'm going by the trade name here because that's what his nurse kept saying. So it's Neosar, which is the Cytoxin, and Adriamycin. They are just, I don't know if they're generic type.
You're getting 8 doses. Is it 4 doses or 8 doses of those every 2 weeks?
I have no idea.
It was 4 doses, so it's every 2 weeks. It's 4 doses, so it's 2 months.
Right. So with this drug cocktail, he really is expecting to see some shrinkage.
And if it does not, there is a third medicine that we don't know the name of.
No, well, this is the second medicine. Taxol will be the medicine that I get second. So I guess I get a month of Cytoxin and Adriamycin, and then I will get Taxol. And then
if the first two don't work, there's one in the middle of these. Taxol was the last one.
Oh, was it?
We didn't have a sheet on it. But if there's no size reduction or he's not getting what he wants out of the first two after the 4 doses, he will pause the Cytoxin or the Taxol, and there's a third medicine that can be used that shows great results doing that. So it will do that one. Sorry, it's very overwhelming to go through. I listened quite a lot. So the third one will go in, and then we will finish with the last one, the Taxol.
Right.
And he expects by the end of chemotherapy to not be able to see the tumor. He expects to shrink it so much that he won't be able to find it.
Right. Hopefully it will be gone. And if not, hopefully I will just have a lumpectomy.
Because the whole theory behind the whole thing is if you're affecting it here and it's spread throughout your body and these drugs are working. Oh yeah, the bat. I don't know why the camera's... Is it actually still? Yeah, I see the dot. Okay, so we've covered everything. And then once the first 2 drugs will take out the biggest side effect, it will take out her hair. She's very worried about that, but I have reassured her over and over that my wife is very beautiful. She's always been beautiful. And
it's not a matter of that. I'm a woman, and it's all about the hair. But
they've come so much farther. My dad passed away from cancer in the 80s, and the chemotherapy was awful. It is still not pleasant, but one thing he does, hydration is supposed to...
They give you lots of drugs.
Hydration is supposed to help. And so the way he's given, he calls it a hydration boost. Instead of having somebody, you're sick, go home and drink all this water. Joany, she will get the chemo one day, then we'll go back the next, and she'll get a full bag of saline solution to hydrate. They also give steroids with the chemo to boost you up.
And Neulasta, which I'm sure y'all have seen the commercials. It's like a little onboard patch, and it helps to boost your white blood cell count so that you don't
You'll get
you're
sick,
not
right?
you're not as prone to colds, what have you.
Because they don't want to do anything to slow it down. They want to stay on schedule. They want to fight this thing through. They want to hit you. So you need your white blood cell counts to stay up. So and so he said that the first day afterwards you're fine. You feel great actually, because most people with the steroids. And then the second day afterwards you start feeling a little crummy, and the third day is the worst day. The fourth day starts to turn back up. By the fifth or sixth day, you're end of the week and seventh day back. So if you do it on Monday, by Sunday you're back to normal again, and then you have a full week of being you, and then they hit you again the next week. So it's every 2 weeks. And it's a 2 week cycle, 2 weeks. But they space it out that way so that you need to give it, you need to fight, and then your body needs to recover and rest so it's ready to do it again, instead of just beating you so far down that your body can't fight. So,
and that made me feel a little bit better, because I just, I think about these are toxins going in your body to kill something. So
each week we want to talk about what's happened, and then we'll tell you what's going to happen the next week, and then we'll tell you about what happened then. So for next week, what's on the schedule for this?
Tuesday, I have a PET scan. Let's vote for which one of these are going to be doing my PET scan. I'm just kidding. That's not how it works. And a brain MRI. And Scott's been wondering for many, many years, what's really up here?
I would guess I'm
So let's all take a guess. Scott, I want you to put the picture of a breast MRI in the video.
I'm going to insert a picture of the machine and what it looks like. It's not anything pornographic or anything, but just to show you the contraption that
not comfortable. Everybody, thank you so much for watching. And
so this week there's nothing coming up really. Wednesday he will call us Wednesday morning or Wednesday afternoon with the results of all the.
I go see him Wednesday morning.
Yeah, we're going to see him Wednesday, and we'll make the video after we see him. So he'll have he will present it to the cancer board. So that he will have a group recommendation to go along with what he thinks. He will have the results and he needs because he said I can't properly stage her without, you can just guess. He said I can guess right now stage 1, but if it's just here and it's just localized in this breast. But if it's metastasized to your brain or somewhere in your body already, and I don't know about it, and we don't know to fight it like that, he said it makes a complete difference, a huge difference. So that's why they are doing the full body scan. Not to mention Joany has a lot of migraines. She's prone to migraines to begin with, and she's having more headaches than normal. And so he wants to rule out. There's a lot of them. You said were in front of you, and which are stress related. And he said that because he immediately said, "Well, they in the front," and Johnny's like, "Yes, they're in the front." He said that is definitely stress related. That is generally not anything to do with cancer or tumor. But he said, I don't deal in generally. I deal in a scan to let us know exactly what's going on. So that's the reason why the scans are coming. The earliest they could do it was Tuesday. We meet with him Wednesday. And the next Wednesday's video, we'll be able to tell you the chemo is going to start here, what they found. And we're going to, each week, just try to tell you what we've gone through, what we've learned. Because we truly didn't know anything about breast cancer other than we hated it like anybody else. And we've done some walkathons and we've donated to causes and stuff, but never been like super active in it. But enough like everybody else, because you just don't know how devastating this is. And I never knew that breast cancer attacked a woman's entire body. I mean, I guess I'm just that naive because
I didn't either.
Because we're just been very blessed as a family on both sides not to have a lot of any of that. So we just want to be able to. I mean, I have a small YouTube channel, but we just want to help educate folks. Everybody knows Lonnie Garage Flips. Candace is a breast cancer survivor.
And I have many friends who are breast cancer survivors, and I'm thankful that they've helped pave the way for me to lift me up and just support me throughout this. I never knew that I was going to be flipped a curveball and have the rare form of breast cancer. Of course, there are more rare forms of breast cancer out there, but triple negative is a booger. I want to say to everybody that has been praying for us, thank you so much. I mean it from the bottom of my heart. And please continue to do so, because I can't do it without those prayers. And I really do appreciate it.
Yeah, we are both, our entire family is born again Christians, and we truly do believe that, we believe in the power of prayer, and we believe that, we believe what the Bible says, that if you believe with all your heart that you're prayer, you can move this mountain. We truly believe these things. And so we thank you very much for your time. We thank you very much for your thoughts, your prayers, and your kindness. And we look forward.
The video.
Please like the video, share it if that's something you feel desire to do, because we'd like. I'll track the money on this video, and we would donate it to
our local breast cancer.
Because I'm gonna monetize the video, but we're not going to keep any money. We're definitely going to donate all the money, the proceeds, or anything. So if this can be shared, so that another person can. There's a lot of fear that goes with it, a lot of anxiety, and like Dr. McGee told us yesterday, this is the most studied, most researched cancer in the world. They have spent. This one, the changes in the last 5 years have been amazing. He said, even as much as 3 years ago, we do things that are drastically different each year, because we learn so much because of all the research. So it's important to raise money. It's important to do these things so not another lady dies of breast cancer. It's that important.
It is that important.
All right. Thanks for watching. We'll see you next week.